Today's guest is Dr. Neil Nathan, and the topic of the show is toxic. I am very excited today to have Dr. Neil Nathan on the show, talk about his new book and how he's approaching treating some of the most complex chronic illness patients. Thanks for being here today, Dr. Nathan.
Yeah, my pleasure, Scott. Thanks for having me.
Let's talk first a little bit about the distinction between toxicity and sensitivity. So in the book, you talk about toxicity, where the body is toxic with specific substances. And then you talk about sensitivity, where there's a hyper-reactive type of response to certain substances. So would you say that most of your patients are both toxic and sensitive? Can they be one or the other? And how do you differentiate those two?
As always, excellent questions. I think that for many practitioners, when a patient is hyper-reactive to the things they're trying to provide, many practitioners won't make an effort to distinguish whether it's sensitivity or toxicity that's triggering it. Now, in truth, for most of my patients, it's both, but not always. And I think it helps to refine the way we are treating if we know with more precision what we're treating. So for me, sensitivity is a manifestation of a hyperreactive nervous system. The limbic system or other parts of the brain have become hyperreactive to a wide variety of stimuli: light, sound, touch, chemicals, food. Any or all of the above can be a stimulus so intense that the patient has difficulty dealing with it. It can even, if extreme, trigger some neurological events like dyskinesias or pseudo-seizures or a variety of neurological manifestations, which actually can be very hard for even neurologists to define. They're clearly a neurological event, but when you do an EEG, you don't get true seizure activity. If you test in normal ways, you can't label it in a nice little way that you would like, where you could provide medications, for example. But it is a true, absolute hyperreactivity of that nervous system.
I know that you've even said that some people can be reactive to water, which is surprising to some people to hear that. They immediately think the person is psychological, psychosomatic, but that is one of the things that you've mentioned people can react to. What are some of the key sensitizing events or triggers that lead to a hyperactive nervous system?
Okay, let me just back up. When people are hyperreactive to water, usually that's mast cell activation. In fact, if someone tells me that they will have flushing or hives or tachycardia or anxiety or any number of reactions when they drink water, that is the tip-off that we're looking at a very clear case of mast cell activation. And I want to distinguish that from the hyperreactivity of the nervous system, which can be mast cell activation, but can also simply be an inflammation of the limbic system. So,
very good.
Sorry for that.
No, that's fantastic. That's exactly what I want to try to understand better for listeners.
Okay.
So in those hyperreactive people, then, what are some of the triggers that you commonly see?
Well, first of all, the top two causes of that type of reactivity are either mold toxicity or Bartonella. Occasionally Lyme, occasionally Babesia, other infections, sometimes viral infections, other toxins can do that. During the recent fires here in Northern California, when smoke descended into the valleys and even as far as the Bay Area, almost all of my patients who are hypersensitive found themselves even more reactive. The smoke is a trigger. Annie Hopper, for example, who put together an excellent limbic system retraining, and I know you've had Annie as a guest on your program, her original triggering was a combination of the fires in northern Canada coupled with mold exposure. So That's a common one, not always appreciated, but any chemicals can do so. But I want to come back to the key point. Mold toxicity, Bartonella. If you have someone who's super sensitive, please think about those two entities, because the vast majority of the people that I treat, those are major triggers, and they're treatable.
So when we say they're treatable, if we think about the toxic side of things, we'll talk more about this later, but people think about binders, detoxification. What are some of the types of things we might think about when we're treating this hypersensitivity?
Well, to beat a drum, and I'm going to keep doing it, number one, think about diagnosis. The absolute first thing that you want to do is, what's causing this? And the reason I'm emphasizing that is that there are many approaches to treating the chemically sensitive patient or the hyperreactive patient, which are very helpful and very useful. But if you don't cure the cause, you're going to be spinning your wheels. That patient will improve, sometimes a lot, but they won't get well until you remove what's triggering it in the first place. At that point, they don't need to do any treatment. And so I think that's a key point that I'd like listeners to take in.
And when you say when you remove the original trigger, they don't need to do any treatment, is it not the case that in some scenarios we can maybe remove that trigger and still, as you talk about in the book, need to do some types of rebooting activities to get the body to now more correctly respond to the environment?
Yes. A key component of my book is to help both physicians and consumers understand that once the system has been stuck, inflamed, and unable, it can't always heal itself. So you may be able to remove the original thing that triggered it, and for many people, that's all they need. But for lots of other people, they need to literally reboot the systems that are stuck. And in my book, I lay out all the systems that this could relate to, particularly rebooting the nervous system, rebooting the immune system, rebooting the gut and the microbiome, rebooting the endocrine system, and so on. That being back up to full operating, running.
So for the hypersensitivity side of things, it's removing the trigger and potentially then doing some of these rebooting activities that we'll talk about later.
Yeah, very much so. But I'm going to take a step back, which is, for many of the most sensitive patients, they can't even begin treating until they quiet down that hyperreactive system. Their bodies are so reactive in a variety of ways. It could be a limbic dysfunction. It could be a mast cell problem, which is triggered in the majority of my patients with mold and Bartonella. So you have to spend time with the patient and understand why is this individual so reactive, exactly how are they so reactive, and literally pre-treat them to even get to point A where you can even begin treatment.